Hello everybody, this is Dr. Tilak from the Department of General Medicine. Today I'll be discussing another topic from neurology, and this is about the different lobes of the brain and their functions and dysfunctions. So today I'll be describing in detail frontal lobe and its functions, and if there is anything abnormal, what are the clinical manifestations. So basically, first thing is that cerebral cortex is not a uniform structure all over the brain. The structure is variable from one part to other part of the brain. So it's heterogeneous, either in its structure or in its functions. And each part of the brain has got connections with various other parts of the brain. It may be connection from one cortex to another cortex of the brain, or connection of the cortex with the subcortical structures or diencephalic connections. And there are large number of neurons, but basically there are so many billions of neurons in the cortex if you count the neurons all over the brain. And beside the neurons in the cortex, there are various other supporting cells, what is called glial cells. So when we look at the brain of the human beings, most of the brain is basically relatively phylogenetically new or neocortex. So because of the evolution of human beings, there is more and more increase in the size and special functions of the brain. And if you look at the cortex of the brain, there are several types of cells. Two are relatively large in number. One is the large pyramidal cells, and slightly more numerous are the granular or rounded cells in the cortex. They have got different types of functions according to the site in the brain. So if you look at the structure of the cerebral cortex, there are multiple layers. So easily you can identify at least 6 layers in the cortex, though the thickness may vary from one part to other part of the brain. So there are different layers in the cerebral cortex, and this may be slightly variable from one part to other part of the brain according to the functions of different lobes of the brain. So when we talk about the functions of the brain, these functions will be different from one lobe to another lobe. In the brain, there are certain parts of the brain which have got specific functions only. Like if you look at the occipital lobe, it has got a specific function for vision. It does not serve any function related to any touch sensation or pain sensation. Similarly, there are some motor cortex areas there for motor function, sensory cortex is there for sensory function, etc. So these functions are according to the different sides of the brain. So if you look at the frontal lobe, for example, it has got multiple functions because it is very big in size, and because of the large size, there are different parts of the frontal lobe which serve different functions. So if you look at the functions, there are two types of cortex. One is the unimodal cortex and other is the heteromodal cortex. Which means unimodal means this particular cortex receives only one type of sensory input. Like occipital cortex, it receives only visual sensations from the eye and optic pathway. It does not receive any other sensory input. But when we talk about heteromodal cortex, it means that particular part of the brain receives multiple type of sensory input. It may be touch sensation, it may be pain sensation, it may be some other type of sensations. So that is called heteromodal type of cerebral cortex. So coming to today's topic, that is frontal lobe. What are the usual functions, and if there is something wrong, some abnormalities there, some pathologies there affecting the frontal lobe, then what happens to the function of the frontal lobe? So let us first look at the frontal lobe. Basically, frontal lobe is the largest part of the brain, is the biggest lobe. So it basically lies, there is a central sulcus here, and in front of is the part of the brain is the frontal lobe. It is the largest lobe of the brain. Okay, so in front of the central sulcus and above the sylvian fissure. And there are different types of neurons present and different types of subparts of the frontal lobes are there. It has got motor cortex, premotor area, supplementary area, and the medial part, orbital part, cingulate gyrus. There are multiple subparts of the frontal lobe which serve different types of functions in the functions of the nervous system. So if you look at the overall functions of the frontal lobe, these are the different functions served by the frontal lobe. One is the higher mental functions or cognitive functions, what is called problem solving, and spontaneity means whenever something is there outside, whether it is sensory input, auditory input, or some interaction with the surrounding or human beings. So how well or how spontaneously we interact, that also is dependent upon the functions of the frontal lobe. And also memory, especially the immediate memory, is dependent on frontal lobe. The language function is because of the Broca's area, which is situated in the left frontal lobe. And also other parts of the behavioral functions of the brain, like motivation and others. So these are the different functions which are served by frontal lobe. So frontal lobe is connected with various other parts of the brain. So if suppose this is the frontal lobe, it has got connection with different parts, different lobes. In fact, each part of frontal lobe is associated or is linked with every other part of the brain through one or other pathway. So it may be related to sensory part of the post-central gyrus of the parietal lobe, it may be related to connected to thalamus, it may be related to red nucleus, it may be related to midbrain and others. So there is a multiple connections of frontal lobe. In fact, each part of the brain is having some connection with every other part of the brain through various pathways. For one function of the frontal lobe is the motor activity, but this motor activity, which is served by the motor cortex, this part of the frontal lobe does not work on its own alone. It requires multiple inputs from other parts of the brain. So it requires sensory guidance. Sensory guidance means it requires visual clues, it requires touch clues and others. So all these clues are required for proper motor activity of the motor cortex. It is not the motor cortex can do any motor activity on its own. It requires auditory input, it requires visual input, it requires touch inputs and others. So many sensory inputs are responsible for motor activity of the frontal lobe itself. And for other activities of the frontal lobe also, various inputs are required from other parts of the brain. So as I mentioned, there are various parts are there and they serve different types of functions. One area is called area 8, which is near the premotor area, which is responsible for turning the eye to the other side. Which means if this area is on the left frontal lobe, it will turn the eye to the right side, which means abduction of the right eye and abduction of the left eye. And also there is one area on the left side near the inferior part of the frontal lobe, which is called Broca's area, and it is responsible for various motor type of language functions. So whenever there is some abnormality in the Broca's area, there will be Broca's aphasia or motor aphasia. And other parts of the brain are medial orbital part is there, cingulate gyrus is there, insular gyri are there. They also serve different types of functions. So these parts of the brain, like medial orbital part, cingulate gyrus and insular gyrus of the frontal lobe, they are responsible for functions like proper control of respiration, blood pressure and also various other autonomic functions. For example, regulation or control of the bladder and bowel. So this frontal lobe has got multiple functions, not only for motor activity but higher mental functions like cognitive functions, movement of the eyeball and various types of autonomic functions. Within the frontal lobe, the most anterior part is called the prefrontal cortex. So it has got mostly functions related to the behavioral functions of the brain, like personality functions and also social behavior and executive functions. So this most anterior part of the brain is responsible for higher mental function in the form of executive functions and also for social behavior, how we should talk, how we should act, react, what is socially appropriate, what is socially inappropriate. It is all decided by the prefrontal part of the frontal lobe. Another part of the frontal lobe is the motor function of the brain. So this one important part of the motor system is the motor neurons. These motor neurons are situated not only in the precentral motor cortex. This is the primary motor cortex. It contains motor neurons. But motor neurons are not present only here. They are present in the post-central parietal lobe also, and few motor neurons are present in the supplementary or pre-motor area also. So these motor neurons are dispersed over multiple sites. Motor cortex, also part of the sensory cortex, and also part of the premotor area. And they constitute motor pathway or pyramidal tract, which is responsible for motor innervation of various parts of the body. As I mentioned, this frontal lobe has got connections with various other parts of the brain. So there are several pathways out there which serve as the connection or bridge between the frontal lobe and other parts. It may be frontal lobe and brainstem, it may be frontal lobe and thalamus, it may be frontal lobe and occipital cortex, etc. And also it has got connection on the other side of the frontal lobe also. There are multiple connections are there to serve various functions. This is basically a summary of the different types of functions served by the frontal lobe. One is it has got motor functions. Frontal lobe also has got cognitive functions, behavioral functions, and various other functions. So the motor part, not only it is the motor activity, but how the motor activity is planned and how it is started and how spontaneously it is carried out. All these are part of the motor functions. And also if you look at the motor part of language or Broca's language or Broca's, which is served by the Broca's area. So this is also part of the motor activity served by the frontal lobe along with the eye movements. So besides the motor function, it has got various types of cognitive functions. One is the immediate memory and problem solving. Suppose some work is to be done, how it is to be done, and why it should be done. So this requires higher mental functions of the frontal lobe. So this is called problem solving and also decision making or judgment. What is good or what is bad. And suppose some situation is there, how to understand the meaning of that situation. What is called abstract thinking. If you suppose you give a case scenario to the person and ask him what he makes out of that scenario, or abstract thinking. This is all part of the frontal lobe. Besides this, frontal lobe also serves various types of behavioral functions, like personality. A person is very loving, or a person is very angry, or very sad, etc. It depends upon the function of the frontal lobe. And also how we act with other people in the society, in the family, in the surrounding. So social and sexual function is also served by the frontal lobe. So if there is anything wrong in the frontal lobe, the social interactions may be abnormal. And how to control, how to respond to the surroundings, how to control your reaction or response. Again, it is also decided or dependent upon frontal lobe. And also attention to the surroundings also to a great extent dependent upon the frontal lobe. So they are the different types of functions served by frontal lobe. So let us look at the blood supply of the frontal lobe. So basically it is dependent upon the anterior circulation, which comes from the branches of the internal carotid artery. So if you look at the blood supply of the frontal lobe comes from two branches. One branches of the internal carotid. One is the anterior cerebral artery and second is the middle cerebral artery. If you look at the medial part of the brain, this is the medial part of the frontal lobe. This is dependent upon the anterior cerebral artery. But if you look at the outer part or lateral or dorsolateral aspect of the frontal lobe, it is dependent upon middle cerebral artery. But if you go into the deeper part of the frontal lobe or deep white matter and others, they depend upon various perforating or penetrating arteries coming from the anterior circulation. These are called lenticulo-striate vessels. So basically, frontal lobe is mostly dependent upon anterior cerebral artery and middle cerebral arteries. Suppose a patient has got some lesion affecting the frontal lobe. The lesion may be anything. It may be a stroke, it may be some abscess, it may be tumor, it may be traumatic injury, etc. Then there will be dysfunction of the frontal lobe. So manifestations will depend which subpart of the frontal lobe is affected by the disease process, and depending upon them, that various dysfunctions will become apparent. Suppose a patient has got some disease affecting the frontal lobe, mostly in the motor area or premotor area. So patient will have various types of neurological deficiency in the form of either paralysis or poverty of movements. Movement may be slow or little bit. And if there is involvement of the Broca area on the left side of the frontal lobe, there will be various language dysfunctions will come. And if the injury affects or the lesion affects the cingulate gyrus and adjacent part of the frontal lobe, there will be dysfunction of the bladder and bowel. And also, if there is more frontal part of the or anterior part of the frontal lobe is affected, then there will be various dysfunction of the cognitive type, like executive functions may be affected, decision making may be affected, and also interaction with the surrounding people or surrounding atmosphere, how the patient reacts or does not react. It also depends upon the frontal lobe. So there will be different types of less interaction with the frontal lobe. So it may be little bit abnormality like apathy, or it may be complete lack of interaction with the surrounding. And also various types of personality abnormalities will also develop. And besides this, patient may have abnormality of the gait, what is called freezing gait. Like if a patient has got frontal lobe involvement, which is affecting the motor parts of the frontal lobe, so what will happen? There will be hemiparesis if the entire motor cortex is gone. So if the left frontal lobe is gone, there will be right hemiplegia. If the right frontal lobe is gone, then there will be left hemiplegia. So there will be loss of voluntary movements because of involvement of the motor cortex. Okay. So if there is involvement of the supplementary motor area or premotor area, then what happens? It affects the coordinated movements, large movements. Individual muscle movements are not affected by the supplementary motor area. And if there is involvement of the posterior part of the frontal lobe, it may cause contralateral spastic paralysis or paralysis. If the lesion is more anteriorly situated here, then paralysis is less. It results in various dysfunction in the form of abnormalities of the executive function, abnormalities of social behavior, etc. So anterior lesions result more in the form of release of various reflexes like sucking reflex, grasp reflex, etc. So when the lesion is more anterior, here paralysis is not seen. Paralysis is seen more often when the motor cortex or premotor area is affected. And also if there is a lesion of the frontal lobe, other manifestation may also come. One is when there is a lesion of the supplementary motor area, it will cause decreased motor word output. So patient may be totally mute or may speak very few words. And also when there is some movement of the body, the patient may have neglect of the movement of the body of the other part of the body. If the left frontal lobe is affected, the patient may have contralateral, that is right side motor neglect. So basically the supplementary motor area is not primarily responsible for execution of motor functions. It basically instructs or orders the motor task to the primary motor area. So if the primary motor area is gone, then individual muscle paralysis will be there. If the supplementary motor area is gone, then there will be paucity of movements. It will not be total loss of movements. And also if there is involvement of the motor area 8, which is called frontal eye field, then there will be conjugate gaze palsy. If the patient has got involvement of the right frontal lobe, then there will be paralysis to the patient will not be able to move the eyeball to the left side. So whatever side of the lesion, the person will not be able to move the eye to the other side. Suppose a patient has got left frontal lobe, then patient will not be able to move the eye to the right side. So this occurs when there is involvement of the area 8 or frontal eye field. If in case there is involvement of the Broca area or insular area, then what are the clinical manifestations? So as I mentioned, Broca area is on the dorsolateral part, inferior part of the frontal lobe. There will be Broca's type of aphasia or motor aphasia. And also if there is involvement of insular cortex part of the frontal lobe, there will be few additional manifestations. There may be agraphia, there may be apraxia of the face, lip and tongue, which means person does not have paralysis, but on command the patient cannot move the facial muscles, but spontaneously the movement may occur. So it occurs when there is involvement of the insular part of the frontal lobe. Other manifestation of frontal lobe may be apraxia of gait, which means the patient does not have paralysis of the lower limb. If the patient is laying in the bed, he can move the legs. He can move the legs in the form as if he is making some cycling movement. But if you ask the patient to stand and then walk, person is not able to move forward. So it is not because of paralysis, it is because of apraxia. It is seen typically in patients with involvement of the frontal lobe. This is called apraxia of gait or magnetic gait. So person remains standing at one place, he can't move forward, as if there is some paralysis, but actually it is only apraxia. So if there is involvement of the prefrontal subdivisions, you can say the anterior most part of the brain, then what happens? Firstly, it is heteromodal. It means it receives multiple inputs of different types, sensory, visual, auditory, etc. And then it has got lot of connections with other parts of the brain. Reciprocal connections are there. In this way, it serves its functions. So whenever there is involvement of the prefrontal part of the frontal lobe, there will be various abnormalities, especially abnormalities related to the higher mental functions like decision making or executive functions or planning something, like you have to do some work, how to do it. And once you have decided how to do it, then start doing the work. Again, it depends upon the frontal lobe. And once you have started doing the work, how to see that the work is going on properly or not. All these functions depend upon the prefrontal part of the frontal lobe. And also, if there is a lesion of the prefrontal part of the lesion, the various manifestations which may come are like there will be various release reflexes. So these reflexes are present in early life in like infants, but after 1 year or so, these reflexes disappear. But if there is some dysfunction of the frontal lobe, these grasp reflex and other primitive reflexes may come back. So grasping reflex, groping reflex may come back. And beside this, there will be various other higher mental dysfunctions in the form of whether the patient is able to interact with the surrounding or not, abulia is there or not, apathy is there or not, and also other manifestations of frontal lobe dysfunction may come, like motor perseveration. You ask the patient to do something, once he will keep on repeating that. Or there may be motor impersistence, which means you ask the patient to do something, he will do and then stop. Like you ask the patient to take out the tongue, he will take the tongue out and again he will put the tongue back. So it's called motor impersistence. So the other different types of manifestations which may come because of involvement of the prefrontal part of the motor cortex. Sometimes there may be very high degree of rigidity, what is called paratonic rigidity or Halton. It basically means the patient will have rigidity, and if you try to oppose the rigidity, more you try, more will be the rigidity. This is suggestive of rigidity because of the frontal lobe involvement. As I mentioned, if there is a part of the frontal lobe near the cingulate gyrus or medial and orbital part of the frontal lobe, which is responsible for control of the bowel and bladder. So if there is some dysfunction of this part of the brain, there will be various manifestations. So if the lesion is more posteriorly situated here, then what will happen? The patient will have incontinence of the urine and also bowel. So patient will not be able to control if there is a need to go to the bathroom, for example. So even for few minutes or few seconds, patient may not be able to hold the urine or motion. So there will be no warning features. The patient will suddenly pass urine. Usually what happens when you have to go to the washroom, for example, you will get a sensation and then you will try to go to the washroom. But in these patients, suddenly there will be voiding. The bladder or bowel evacuation may be there without any warning of fullness. If the lesion is incomplete, then what happens? There will be no incontinence, but there will be frequency. The moment there is an urge to pass urine, if you do not immediately go to the washroom, the person may not be able to hold it. So here the frequency and urgency is more of a problem. And here the patient will be aware that there was a need to go to the washroom quickly, but due to some reason he could not go, and then there was some incontinence. So the patient will be feeling bad about it. So if there is involvement of the language area, especially if there is a lesion on the left side of the frontal lobe, then the patient will have various types of speech and language abnormalities. This I have already described. The patient may have Broca's aphasia, which is also called motor aphasia. Sometimes it is not complete Broca aphasia, but laconic type speech may be there, which means whatever the response is coming from the patient, he will be using very few words. Or if the response is in written form, then he will be writing very few words. So when the expression is comprising of very few words, then it's called laconic speech. And whatever the speech, the patient will have lot of hesitation to express himself or herself. And whatever the expression, sometimes the grammar may not be normal. It may be abnormal because the patient can't express properly. And sometimes there may be perseveration of speech. This arthria may come because this part may cause dysfunction of the motor part of the tongue, lips, and also the larynx. So that may result in this arthria also. So frontal lobe dysfunction also causes various types of cognitive and intellectual impairment, as I already mentioned. So basically the cognitive part is more dependent on the prefrontal part of the frontal lobe. Motor cortex is there, premotor area is there, supplementary motor area is there. That is for motor functions. For executive functions, cognitive functions, it is the prefrontal part of the frontal lobe which is responsible for various higher mental functions. So it is called organ of civilization. So when there is some lesion affecting the prefrontal part of the frontal lobe, there will be various types of higher mental functions. So patient may have irrelevant talk or irresponsible behavior, or patient interaction with the surrounding, or whenever there is some stimulus, or whenever something is to be done, the lack of initiative will be there. So patient will respond, but he will not be as enthusiastic as normal people are. And there will be various abnormalities in the mood also. Sometimes the patient may not pay any attention to the surrounding. And whatever the situation given to the patient, he will not be able to make a good meaning out of that. This is called loss of abstract thinking, or abstract thought process will be abnormal. And patient will have various types of abnormalities in the personality. So how to respond to others' opinion or others' feeling, that will be abnormal. Social behavior will be abnormal. All these features will be there in the personality of the person who has got prefrontal part dysfunction of the frontal lobe. So as I mentioned, executive function is also part of the prefrontal part of the frontal lobe. So whenever something is to be done, any work is to be done, it requires multiple steps. And for those multiple steps, the frontal lobe has to be normal. Suppose you have got a problem at hand. So how to solve it? Like for example, you have to make a payment for your electricity bill. So how to go about it? So first you have to specify what the function is, and after that you have to decide what is to be done, where you have to make the payment of the bill, for example, and then you will actually go and do that work. That is called execution. And while you are doing that work, you have to see that your work is going properly or not. So they are the all different parts of problem solving, or whatever function is to be done. So these functions depend upon the frontal lobe anterior part. So whenever there is all these functions, decision making, the execution, etc., this depends mostly on the prefrontal part. So whenever there is a problem, the patient will have difficulty in doing all these things. So executive function, as I mentioned, so beside the decision making problem, beside the initiation to start some function, and beside checking the function is going on properly or not, patient may have various other abnormalities. There is a lesion of the frontal lobe. So one is the psychomotor slowing may be there. So whenever there is something going on around, some people are talking, some people are discussing, something is happening, so we respond in a normal way, particular way. So this is psychomotor response will be slow in patient with frontal lobe dysfunction. And also if the patient has got some lesion of the frontal lobe and he is paying attention to something, and there is some little bit distraction from surroundings, from outside, the person can be easily distracted. And whatever the problem is there in front of there, some things to be done. So how to analyze the problem, that function is also abnormal in patient with frontal lobe abnormalities. So beside this, patient will have various other abnormalities in the form of behavioral abnormality and personality abnormality. One is the lack of initiative. Something happens around you, something is to be done, so how fast it is to be done, how spontaneously it is to be done, it depends upon the frontal lobe. So in patient with frontal lobe dysfunction, this part will be abnormal. Initiation will be abnormal, spontaneity will be abnormal, and whatever the person thinks about some work to be done or not, there will be very poverty of thoughts. He will have very few ideas how to do, or what to do and what not to do. And even if something is done by that person, the action will be superficial only. He will not be paying deep thinking about the action to be taken for a particular work. Sometimes what happens, whatever is happening around, they do not bother. They remain tolerant. Something good happening, they remain tolerant. Something inappropriate happening, they remain tolerant. That also may happen in the behavioral part of the frontal lobe dysfunction. Sometimes some work is to be done, something is to be spoken, they may keep on doing it again and again. If you ask what's your name, he will say I am. So this type of perseverance may be there. So this is also suggestive of personality or behavioral abnormality because of the frontal lobe dysfunction. So this is about the lack of initiative and spontaneity. In case the patient has got involvement which is extensive or there is involvement of both the frontal lobes, then the disease manifestations clinically will be much more severe. So whatever the psychomotor activity is there, it will be severely impaired. Suppose a patient has got some problem at home or at the place of work, how to respond to it, what action to take, how to talk, how to interact, that will be severely reduced or because of lack of initiative or reduction in psychomotor activity. And if the person speaks or if the person thinks about something or patient makes a movement, all these will be reduced. Patient will speak very few words or patient will think little bit about the problem and then may stop doing that also. So if the frontal lobe dysfunction is quite severe, the lack of initiative may be so severe, the patient will not move at all. Patient will not speak at all. Or whatever the position of the patient, the patient is laying on the bed or patient is sitting on the chair, will remain in the same posture for long period. This is called akinetic mutation. Okay, so it may appear as if the patient is paralyzed, but here the patient is not paralyzed. It is basically severe frontal lobe dysfunction leading to severe lack of initiative. Like this patient, person will remain in one position for a prolonged period without moving the hands and legs or neck. So this is called akinetic mutation, which may occur in case there is bilateral frontal lobe disease or extensive frontal lobe disease. And these are the various manifestations which may occur in the behavior. So when there is a lesion, especially in the dorsolateral part of the prefrontal part of the frontal lobe, these behavioral and personality abnormalities may come. So either the patient may become very combative, may start fighting very easily, or patient may have severe lack of sleep, insomnia may be there. Sometimes they may indulge in activities which has got no meaning. They may keep on talking something, or they may keep on accumulating so many items unnecessarily. So they may indulge in various activities which are basically good for nothing. So these are all features which are suggestive of behavioral abnormalities due to frontal lobe dysfunction. Other dysfunctions which may come in the behavior of patients with the frontal lobe are an activity called hoarding, which means they accumulate so many things of the same type of different types, even if they don't need it. They may accumulate a lot of clothes, they may accumulate a lot of papers, they may accumulate so many other trash items, and they will keep it accumulated and they are not bothered. Even if they know that it is not going to be of any use, they will keep on doing that. This is called hoarding behavior because of frontal lobe dysfunction. And one more important feature in the behavior may occur when there is involvement of the inferior part of the frontal lobe. When the inferior part of the frontal lobe is affected by any disease process, there may be a lot of social abnormalities in the form of what to talk and what not to talk. It depends upon the function of the inferior part of the frontal lobe. Like suppose a person tells you that a family member has died, so you should show some sorrow. But if we start cracking jokes at that time, it is inappropriate. So that's called the person may crack some silly jokes, or the social behavior may be uninhibited, which means if suppose you want to go to pass urine, you have to take permission, or you have to tell somebody that you want to go, or if you want to shake hand with somebody, if you want to touch somebody, so that requires a lot of social inhibition. So touching somebody inappropriately or touching unrelated person, this type of uninhibited behavior may be there because of involvement of the inferior part of the frontal lobe. And they are not bothered about this type of abnormal behavior because the frontal lobe can't decide that this is wrong. So there may be socially uninhibited behavior, abnormal jokes, or abnormal social behavior may be there when there is involvement of the inferior part of the frontal lobe. Suppose a patient has got involvement only of the right frontal lobe, then what are the manifestations? And if there is involvement only of the left frontal lobe, then what are the manifestations? Let us look at them one by one. If there is involvement of the right frontal lobe, what will happen? Right frontal lobe has got motor cortex, premotor cortex, and also cingulate gyrus, prefrontal part of the frontal lobe. So if the right motor cortex is gone, there will be left side hemiplegia. And also because the right side frontal eye field is not working, so it will not be able to move the eye to the left side. So there will be left side conjugate gaze palsy. And also there will be less interaction with the surrounding. So lack of spontaneity will be there, lack of initiative will be there, and also if there is prefrontal lobe involvement, there will be release reflexes which will become apparent, like grasp reflex, sucking reflex, etc. will come. And also because of involvement of the lower part of the frontal lobe, inferior part, there may be lack of smell sensation. So olfactory dysfunction may also be there. So they are the different manifestations which may occur when the patient has got involvement of the right frontal lobe. In case the patient has got involvement of the left frontal lobe, what will happen? One is that left motor cortex is gone, so there will be right hemiplegia. And because the left frontal eye is gone, the patient will not be able to move the eye to the right side, so there will be right side conjugate gaze palsy. And also there is Broca's area on the left side of the brain, left frontal lobe, Broca's area. So there will be Broca aphasia will be there. There will be various manifestation in the motor part of the speech. And also lack of initiative, spontaneity will be there. And if there is involvement of frontal part of the left, prefrontal part of the left frontal lobe, there will be release reflexes like sucking reflex, grasp reflex also. And also lack of olfaction may also be there. So important feature with the left frontal lobe is that there will be language dysfunction, which is not seen in patients who have got lesion on the right frontal side. In case the patient has got involvement of both the frontal lobe, then what happens? So obviously there will be motor cortex involvement on both the sides, so patient will have bilateral hemiparesis. So there will be bilateral hemiplegia will be there, and because of that patient may have pseudo-bulbar palsy. So there will be inappropriate laughter or crying in these patients without the effort by the patient. Suddenly the patient may start laughing, suddenly the patient may start crying. This is called pseudo-bulbar palsy. And also the lack of initiative or lack of interaction with the surrounding will be severely impaired. So patient may have abulia or maybe having severe akinetic mutism. The patient will not move the hands, legs, etc. Patient will not talk because of bilateral involvement of the frontal lobes. And also whatever the activity around, ability to sustain attention will be severely impaired. And if you give some complex problem to the person, how to ask him how to solve it. Suppose a bill has to be paid, this bill has to be paid, where it is to be paid, the patient will not be able to answer it properly. So patient will not be able to solve the complex problems. And whatever the thinking, they will have the same mode of thinking, they do not change the thinking easily. And also because of involvement of the frontal lobe, prefrontal part on both the sides, the release reflexes will be much more obvious, like grasping reflex, sucking reflex, etc. And also because of involvement of the cingulate gyrus on either side, and here there is involvement of both the sides of the frontal lobe, there will be dysfunction of the bladder and bowel, and also patient may have gait apraxia. So this is just to show the different parts of the brain. So this was about the frontal lobe anatomy and its blood supply, functions of different parts of the frontal lobe, and also if there is something wrong with frontal lobe, what happens. If the entire frontal lobe is affected, what happens. If the motor part is affected, what are the manifestations. If prefrontal cortex is affected, what are the manifestations. And in case there is both frontal lobes affected by the disease process, patient may have severe manifestations. With this, I come to the conclusion of this discussion. I hope it must have benefited you. And next time I'll take up functions and dysfunctions of other parts of the brain. With this, I conclude this session. Thank you for